Hello friends, I am Dr. Kanchan Murarka, infertility specialist and IVF consultant working in Institute of Human Reproduction, Guwahati. So friends, today I will talk about IVF. I will tell what is IVF and how it is done. So friends, what is IVF? So IVF is a procedure where we take out the eggs from the woman's ovaries, mix with the husband's sperm, we make the embryo and keep inside the uterus of the woman to achieve a pregnancy. So how it is done? Now it is a very simple process where we first call the woman when she gets her menses. We do a baseline scan. If everything is okay, then we start the injections for the eggs to develop. So this process usually goes on for say around 10 to 12 days. We do ultrasound also and we see whether the eggs are ready. Once the eggs are ready, we proceed with the ovum pickup. That is the process where we take out the eggs from the woman's ovaries. Now this is again a very simple process. It is done under GA and under ultrasound guidance. So here what we do is we put the transvaginal ultrasound probe through the vagina, then we pass a needle, we put suction and we take out the eggs. So once we have the eggs with us, we keep the egg in the petri dish and we put the husband's sperm also there and we allow them to fertilize naturally. Now sometimes it so happens that the sperm count is very less. So in that case, we may have to inject one single sperm inside one egg, that is intracytoplasmic sperm injection. So once the egg and sperm are fertilized, then they start growing in the lab. So the embryo will grow, it will become 2 cell, 4 cell, and on day 3 it becomes 8 cell. On day 5 it becomes a blastocyst. So once the embryos are ready, then we freeze the embryos. So friends, nowadays we don't do a fresh embryo transfer because the chances are much better with a frozen embryo transfer. So once the embryos are ready, we freeze it, we keep it in nitrogen at -180 degrees Celsius. Now we call the woman in her subsequent menses and we see if everything is okay, then we start medicines for her endometrium to develop, that is the inner lining of the uterus. Once the endometrium is ready, then we proceed with the embryo transfer. Now again, this is a very simple process where we take a very thin tube and with the help of that very thin tube we load the embryos in it and we put the embryo inside the uterus. So it is a painless procedure and no GA is required for this. After this, the woman can go home and after 10 to 12 days we do a blood test and we come to know whether she is pregnant or not. So this was all about IVF and how it is done. Now sometimes it so happens in some women her egg reserve is very less. This may be because of her age or maybe she has undergone some previous surgery or sometimes it is idiopathic. So if the egg reserve is very less and her AMH is also very less, then we may have to go ahead with IVF with donor egg. So here friends, what we do is we take a egg from a donor, we mix the husband's sperm, then we make the embryo and keep inside the uterus of the woman. So this is how it is done. We take a egg from the donor, we mix with the husband's sperm, make the embryo and keep inside the uterus of the woman. So sometimes what happens is there is no sperm in the husband's semen. In that case also we can go ahead with IVF. What we do is we put a needle in the testis and take out the sperm and then we mix it with the woman's egg. We do ICSI, we make the embryo and keep inside the uterus of the woman. So this is how IVF is done. So friends, today I have spoken about IVF, what is IVF and how it is done, the procedure. Now in my next video I will be talking about the indications of IVF. Thank you.